Alrighty. Hello, everyone, and welcome to the third live webinar presentation of the 2022 Hidalgo County Employee Winter Wellness Fair. We will get started already. So I will be starting off this webinar with a sound check. If you can hear me clearly, please click the raised hand icon. Once more, if you can hear me clearly, just go ahead and click that raised hand icon. Awesome. Thank you very much. Our speaker for today for this webinar presentation is Dr. Jonathan Arias. Dr. Arias graduated from the University of Texas, Rio Grande Valley with the Bachelor of Science in Exercise Science in 2016 and later obtained his doctorate degree in physical therapy in 2019 from Texas Women's University. Jonathan was born and raised in the lower Rio Grande Valley in the town of Brownsville and neighboring city of Matamoros. He is now providing therapeutic services as part of South Texas Health System clinics. Before joining the South Texas Health System team in January 2022, he worked at an OP neuro rehab clinic in which he specialized in stroke, PD, MS, and SCI rehabilitation. He currently focuses in the orthopedic and sports population, treating post-op, acute, and chronic injuries. He has several certifications as a certified stroke rehabilitation specialist, an LSVT BIG certification, functional movement screen specialist. He's a fall prevention specialist, and he is certified as a functional integrated needling with the Fit Institute. Alrighty, well, thank you so much, Dr. Arias, and I'll go ahead and give you the floor.
All righty. Hey guys, good afternoon. So today we're going to be talking about ergonomics at work. So we can move on to the next slide. All right, like Diana introduced me right now, my name is Jonathan Arias. Graduated from Texas Women's University in 2019. Came down back to the Valley. As soon as I graduated, wanted to help out the community I grew up in. All righty, so a little bit before we start, I do want to talk a little bit about our locations. So we currently do have 3 outpatient clinics for the STHS clinic site. One is the McAllen Clinic, located in 7900 North 10th Street. That is where I'm currently located. We have another one in Mission, right next off the expressway. And then we have a third one in Palmhurst. And we are actually currently about to open a 4th one in Tres Lagos in Edinburgh. So they're community located for the population. If you guys ever get injured, if you know family members that need rehab, we have our doors wide open for everyone. All righty, so the common question, what is ergonomics? So according to the CDC, it's the science of fitting workplace conditions and job demands to the capabilities of the working population. So basically the way we move during our work, depending on the demands that are required from us. So if you're people who work in office, you're having to sit down a lot of times in front of a computer. If you work out on labor, you're having to do a lot of heavy lifting. So it's basically how you have to put your body and the instruments you require in order to be able to fulfill your job. Okay, why are ergonomics important? So the most important thing because of ergonomics is that they help reduce workplace injuries. So if you work out in labor, it is very common that people end up getting injured, their lower back, their neck, their shoulders, because they're lifting a lot of heavy stuff, sometimes without the appropriate equipment. If you work office job, a lot of times, you have that chronic neck pain because you're staring at a computer all day long. Your lower back also starts to hurt because you're sitting 8 hours a day in a chair. So with ergonomics, it's very important because they help us be aware of, what puts us at risk and how to lower that risk of injury. So in 2021, there were 2.6 million non-fatal work-related injuries. If you think about it, that is a lot of injuries, okay? And for office people, it is 2 out of every 100 administrative workers got reported an injury in 2021. Okay, so the incidence rate over the years. So here I wanted to show this little chart because I want to look at the numbers a little bit. So if you see from 2017 all the way down to 2021, we're approximately averaging 2.5 to 2.8 million total cases per year. Out of those, injuries make up the big chunk, 2 million and above, and then illnesses, and then respiratory illnesses. So if you look at 2020, which is 2 years ago when the pandemic hit us, there was a big increase in respiratory illnesses and just regular illnesses that, that's gastro illnesses, if you have any headaches, all that type of stuff. But If you look at the year after that, 2021, when COVID started to decrease a little bit and decline, you saw a decrease in respiratory illnesses and just illnesses in regular. But the thing that never really decreased a lot was injuries. So injuries, regardless of what's going on out in the world, they're very prevalent, and more so after being, a lot of people working from home, doing office job, you're still putting yourself at a risk of getting low back pain or getting neck pain. Okay, so this is a little chart that breaks up the industries in which the injuries are more so allocated to. Healthcare and social assistance has a bigger number, and that a lot of times is related due to nurses, having to transfer patients. So they end up having low back pain. The retail trade also having to do a lot of heavy lifting, manufacturing, the same transportation and warehouse. And where a lot of people also fall in your profession, it is a professional, scientific, and technical services. Even though if you look at the chart, it doesn't show a big bar. It's still a lot of cases. We're talking about 100,000 cases and above of total injuries and illnesses that happen in the office workplace. Okay, so what are the most common musculoskeletal injuries at work? So I think we've all heard of carpal tunnel syndrome. A lot of times I have patients that come and they're like, oh, I have the carpal tunnel. So basically what that is, we got a little nerve that runs here through the wrist. And because of improper mechanics while we're typing on our computer, it gets impinged, and then we start getting numbness in our hand. We start to lose strength in our hand. So a lot of times, we're having to adjust into getting like a little pad under our keyboard just to try and avoid that extension from our wrist that will compress more the nerve coming out from our actual wrist. Pinched nerves. So everyone has heard, oh, I got a pinched nerve in my back or in my neck. So a lot of times what that causes, it causes also numbness and tingling running down your hand, numbness and tingling running down your legs. So that's when people start also saying like, you know what, I have sciatica. And it all, what ties it together is from people sitting down a lot in their chairs. Herniated disc. That's also a big one. Herniated disc is basically from loading the spine. Meniscus tear, that is related to the knee. Hernias, that's from heavy lifting, sprains, strains, and tears. If you look a little bit at the chart to the right side, you'll see that the primary injury to the upper body will be shoulder injuries. To the trunk, it will be your lower back injuries. And then to the lower extremities, to your legs, it will be primarily knees. Okay, so I'm going to go a little bit over anatomy of the actual spine. So here we have our friend, the spine. So it is broken up into different sections. So it is the cervical spine, which is basically our neck. We have the thoracic spine, which is our trunk region. Then we have the lumbar spine, which is our lower back. We have the sacrum, which is basically where our tailbone kind of goes into. And then we have the coccyx, which is our actual tailbone. And then between those little discs, between those little vertebrae, we have intervertebral discs, which are basically the ones that we call herniated. Okay, so a little bit of the posterior muscles of the body. So I'm not going to go over all the muscles in the back of our body. I just wanted to highlight the ones that we typically end up getting either injured or tied that start reproducing some of the pains and aches that we end up having. So from the back of our body, we have the suboccipital muscles. Those are basically muscles that are located under our neck over here. So a lot of times that we have that forehead because we're, typing on a computer, we're looking down on our phone, those muscles end up getting tight and we start to get like migraines, radiating pain on top of our head, or even running down. Our traps are basically the muscles over here. Same thing from sitting down. You start to get a lot of tightness, and that's when you hear people like, I got a little ball here. It's basically the trigger points in our traps from having faulty postures. Our lats, they're located right in this region. And aside from being in this posture, we're not able to raise our hands properly. Why? Because they get very tight from just being in this hunch over position. Our erector spinae is the muscles from our back. And those basically get strained with improper lifting mechanics from sitting down a long time. The quadratus lumborum. So that's a very important muscle that I want to highlight. It's a muscle that's deep into our lower back. But with that muscle, what happens is, like, for example, if you're working in a desk job, is that if you're kind of seated crooked and, you kind of favor more one side than the other one, or if you have computers like from one side to the other one and you're twisting a lot, It's a little muscle that gets contracted, contracted, contracted. And sometimes people are like, you know what, I have a herniated disc, but actually there's not a herniated disc. Just what's happening is that that muscle is shortening and it's getting tight. So you just have like pain that's just there aching. And a lot of times you feel like, oh my God, it's deep in there. I want like something to come and just kind of like go deep into it. So it just comes from faulty posturing whenever you're sitting down, even when you're driving. Sometimes you favor one side, you have your arm propped one way. So being straight, having proper mechanics is going to be very important. And then multifity is just little muscles that we have in our back that help us with stabilization. Okay, anterior muscles of the body. So I'm going to start with the sternocleidomastoid. It's a long name for basically a little muscle that we had here in the front of our neck. So with that one also gets tight from having this forward head posture. Pec muscles. So pec muscles, I actually target them a lot with my patients who end up coming for neck pain, faulty posture, back pain in their upper back. Why? Because whenever we're sitting down, nowadays we live in a community where we tend to kind of hunch forward and live in this area. So our pecs tend to get super tight. So what happens is that we go into this posture, and a lot of times you can't open up. And even people I have with shoulder pain, they can't raise their hand above the head. Why? Because that pec is just very tight. So a lot of times they think, they have an impingement or they have a torn rotator cuff. And a lot of times that's not the issue. It's just, the pecs are very tight. So they're causing other radiating pains or other pains that are not really there. Our rectus abdominis. So that's a fancy name for a 6-pack or 8-pack if we have one, which I wish I had. So what happens with that one is that a lot of times when you're sitting down, again, that hunched over position, they tend to get very, very, very tight. So that's why sometimes people, if they're laying on their back, they just feel tight in their stomach and they're like, oh my God, I feel like it's stretching out. Why? Because those muscles from the front of our stomach, they just get tight and they don't want to be extended. Transverse abdominis. So this is actually one of my favorite muscles. So this happens a lot with people with low back pain. A lot of times, they're like, hey, mijito, I have a brace and I use this brace because it gives me a lot of support in my back whenever I'm sitting down, where I'm lifting. And I tell them, like, you know what? You actually don't need an external brace. We actually have an internal brace that does the same job. And that is basically the job of the transverse abdominis. So a lot of times it's a very unworked muscle because a lot of times you think about core muscles or like stomach muscles and you think about the 6-pack, you don't think about the muscles that are underneath that actually give the support to our lower back whenever we're doing any lifting or any like hard labor. So that muscle, I like to target a lot in my rehab with patients who have to go through a lot of lifting. Same thing with external and internal obliques. They help a lot with the stabilization for our lower back. Okay, so lumbar spine pathologies. So basically this, I just wanted to talk a little bit about because I know there's a lot of, for me, when I get to see patients, a lot of times I hear like, hey, mijito, again, I went to the doctor and they told me I had a herniated disc, or I had a bulging disc, or I have this going on. So I tend to spend a lot of time and take out my friend the spine, and I just kind of explain to them and give them a little bit of an overview. We're like, hey, this is what a herniated disc is. This is what a bulging disc is. And just kind of give them an idea of what's going on with their spine. So basically, degenerative disc, that means when you're kind of aging and you're putting your body through wear and tear, that disc starts to kind of degenerate a little bit. So it starts to thin out a little bit. A bulging disc. So a bulging disc, basically, it's a disc that's bulging out into one of the nerves, and that's what causes the pinched nerve sometimes. Herniated disc is kind of like the big brother for the bulging disc. It's the one that you want to try and avoid because a herniated disc is basically the inner part of the liquid inside our disc comes out and then it starts to impinging, and that one it takes a little bit longer time to actually heal. Thinning of a disc, as we age, same thing, we don't hydrate properly, we don't exercise, our disc starts to lose a little liquid inside and they start to lose height, so then it starts to compress our spine. That's why a lot of times if you've seen, as we start to get older, we start to lose our height, and it's not just because we're shrunking in, it's just because those discs are actually starting to lose their height, so they don't have the same cushion as they provide. And then disc degeneration with osteophyte formation is just basically bone is starting to form in the spine, and that just starts to irritate the nerves and everything going on. Okay, so cervical spine pathology. So the same thing as for the lower back happens in the neck. Okay, same thing: degenerative disc, bulging disc, herniated disc, thinning disc, and disc degeneration with osteophyte formation. I did want to point out in this little picture is that you can see there the actual pinched nerve, how that affects whenever you have one. The bulging disc will compress on that nerve and it will recreate those pains that are shooting down our arm or down our leg if it's affecting the lower back. Okay, so common standing postural problems. So I wanted to point this out because even though we all have a body, not everybody is positioned the same way. We all have preferences on the way that we stand, the way we move. We tend to favor one way, we tend to favor another way. So here, the ideal posture, for me, there's no perfection. Every time I get to see a patient, I never tell them like, hey, I want perfection from everything, because we are all built differently. So in the PT world, there's something called the plumb line, which is basically a little string that hangs from the ceiling, and that line should cross certain landmarks in our body. But again, I never use it. I just try to make it as close as perfect as possible for each patient, but understanding that everyone has a different anatomy and a different way of moving. So I'm not looking for perfection. So here, one is sway back. That's basically when you're kind of leaning back a lot and not standing straight. Military back is basically when you're kind of kicking your buttocks out and you kind of curve your lower back more than necessary. Flat back is basically having a flat back. Kyphotic, lordotic, basically what that means is that you have an increased posture where your upper back is kind of this in this hunch position. And then forehead is the one that we all know because we spend a lot of time in the computer on our phone, which is basically just with our head forward. Common sitting postural problems. So here, I just want to point out, again, being in the office a lot, we get tired of being in one position. Our body is meant to move, but at the same time, even though we have the freedom of movement, we shouldn't get into positions that are going to put us at a greater risk of suffering lower back pain or neck pain. So here you see the first person, they're hunching forward a lot. The second one, they're kind of sliding through their seat. The third one, they're basically trying to get inside the computer. All right. So again, what is perfection? So in this slide, I just want to talk a little bit about the ergonomics about sitting whenever you're in front of a computer. So first of all, you want to have your upper back straight, not hunched forward or hunched back too much. Secondly, you want to have some support to your lower back. So a lot of times, we experience, and even myself here in the office, I have chairs that sometimes they're just flat. They provide no back support. So you can just go, to your TJ Maxx. You can go to on Amazon and find those little cushions that provide a little support to your lower back. So it's able to be in a normal posture and not be either too flat or too curved down. The hips, you want it to be at a 90-degree angle. The same thing with your knees. They kind of want to form an L and then form an L going down. Your feet, you want them to be flat. Your arms, same thing, an L position and 90 degrees. And your wrists, as we talked earlier about carpal tunnel, you want them to be in a flat position whenever you're typing, and not for them to be extended, because that will put you at a risk for carpal tunnel. Same thing with the actual monitor. You want it to be at eyesight, because if not, I'm going to talk a little bit later about this, but you're going to be in that forehead, and that just starts to put a lot of compressive forces on your spine. Okay, so here, what I was just talking about, cervical spine loading. So basically, the more we look down, the more pressure we put onto our actual cervical spine, our neck. So if you see in an upright position, we're just putting 5 kilograms. It kind of equals out to like 11, 12 pounds. And the more we go, if you see in the very last one, he's at 60 degrees of flexion, which is basically kind of looking this. You're putting 440% more load into your spine than from an erect. So just even like a slight little flexion from being on your phone or on your desk, it'll put a lot of compressive forces into your spine. And I'll talk about why that's important right now. Okay, so let me go into the lower back. So here, same thing, the posturing, how much pressure is put into your actual spine. So I want you guys to see the one that's standing. So that's basically the normal one, 0.5 MPAs, which is basically how much pressure you're putting into the vertebral disc inside your spine. And if you're laying flat, that's the less pressure. But if you see there's people who are doing faulty posture, the next one that's right next to it, when you're sitting down, kind of hunch over position, it kind of doubles up. And then when you go to the next one, if you're kind of hinging down to pick up something, it even increases more. So that's when you know that posture and lifting mechanics is very important, because it measures how much pressure you're putting into your spine and how much more predisposed you are to developing a herniated disc, a pinched nerve, and all those other pathologies. Okay, so this is a controversial topic that we we're speaking here in our office about. So a lot of times with lifting, there's this misconception a lot of times, and even for us in the PT world, like when I went to school, they always told you like, hey, when you're lifting, lift in a squat position, supposedly that's the way that you're less prone to getting injured, et cetera, et cetera. So they've done a lot of research to actually look at what is the best lifting position. And they actually found out that with the first one, which is the stoop lift, which is the one that we typically tell people not to do because it's going to hurt your back, it actually doesn't even increase the risk of developing low back pain compared to the other three. All righty. So I tell my patients, whenever you're doing something, do something that fits to you. Same thing happens with squatting. Like for me, for the younger population, they'll tell me like, hey, is there a perfect way to squat? And I'm like, no, there's not a perfect way to squat. There are certain things you should look out for, but you don't want to be the same as everyone, because same thing, we're all built differently. So you might have a shorter trunk, you might have longer legs, you might not have the mobility that other people have. You might have other medical conditions that kind of affect from like stooping. Let's say you have low blood pressure and you're stooping forward and then you come up, that's going to decrease your low blood pressure and then you're just going to faint. And we don't want any of that in the workplace. And that's a workers' comp. So basically, the research does say that the best method to lift is actually the semi-squat lift. At the end of the presentation, we're going to do some live demonstrations with my co-worker, Luisa. She's a PTA here in the office, and we're going to go through all three different ones so you can see the difference in life. Okay, so this is the 8 commandments of lifting. So basically, it's plan your lift and test load. So basically, it means that whenever you're going to lift something, know what you're about to lift. A lot of times, maybe even at home, not only at the workplace, you're like, hey, in my case, when with my wife, she's like, hey, go pick that up. And sometimes I'm just going to go and pick it up without thinking like, hey, is this going to injure me? Is this too heavy? Is this too light? So same thing happens in the work office. Let's say they tell you, hey, go pick up that box of paper for the printer. You're like, okay, is that too heavy for me? Is it too low for me? So you got to plan ahead and say like, you know what? Is there something else that I can use to lift this instead of using my body? Because maybe I don't have the mobility to get into that. Second thing, ask for help. If it's something too heavy, you're like, you know what? I don't know. I'm not sure if I can lift it by myself without injuring. Ask your coworker. There's always someone next to you that can lend you a hand to perform the task. So again, you don't get injured. Get a firm footing. So basically be firm whenever you're lifting. Don't be all wobbly. Bend your knees. Tighten your stomach muscles. That's what I was talking earlier about that transverse abdominis muscle. You really want to train it and engage it to tighten and stabilize your lower back so you don't suffer an injury. Lift with your legs. Keep loads close. That's also very important. Whenever you're lifting things, you want to keep them as close as possible because the further they are from you, the more load you put into your spine. And then keep your back upright so you don't be rotating and kind of moving all over the place. Lifting do's and don'ts. Same thing. This is just a little reiteration from what I just spoke. Lift as a team. Turn with your legs. This is very important because sometimes when we're lifting heavy things, let's say if you're just lifting, a grocery bag, you can twist, but if you're lifting something heavy and you're performing twisting motions with your lower back, that puts you at a higher risk of actually developing a herniated disc because of that twisting mechanism into your lower back. Do use your legs, and like I said, do use equipment. If it's something heavy, you have a dolly, or you have a chair that you can push with little wheels and you can put things and transport them through the office so you don't get injured, do that. Okay, so now we're going to move to the fun part, to the live demonstration. Like I said, we're going to be going through all 3 lifts, the stoop lift, the semi-squat lifting, the squat lifting, and then I'm also going to go through my coworker, Luisa. She's going to be showing you guys how to do a couple of standing stretches and seated stretches that you can just do at work without having to go, to the gym or that require, expensive equipment whatsoever. Okay. So I'm going to move the computer a little bit so we have a better view. This is Luisa. Okay, I think we can see that. Okay, so the first one we're going to do, sorry, let's move back one slide, please. All right, yeah, so we're going to go through the stoop lifting. So like I said, this is the one that there's a lot of controversy for people not to do, but again, the research says that you are able to do it if it's low loads, moderate loads, not trying to carry anything heavy. So we're going to arch down, bend our knees about 30 degrees, and from there, pick it up. Like I said, it is very important to keep the load close to your body whenever you get to the upright position and not just leave it up hanging in the air. Second one we're going to do is going to be the squat lifting. So we go all the way down as low as we can. We pick it up, same thing, keeping it as close as we can. Then the third one, which is, like I said, the best one according to the research, it's a semi-squat. So it's a combination between stoop and squat. So we don't go into a full squat. So we'll go down, keep our back a little bit forward, and then from there, we come up. All righty, perfect. We're gonna move on to the next slide, please. So from there, we're gonna do some standing stretches and mobility. So this I wanted to point out for you guys, because again, we're in the office and sometimes we're like, oh my God, I want to go to the doctor, I want to go to the PT, I want to go to the chiropractor because I feel tight, I feel this. So these are things that you can just do at work to decrease some of that tension, some of that maybe pain that you're having, and it'll make you feel better. Okay, so the first one is going to be called wall angels. So you're going to put your hands against the wall and you're just going to go upward direction and then downward direction. So that's going to really stretch out your pec muscles, your forward muscles. It's going to help improve your mobility for your back spine, from being in that hunched forward position. So in this exercise, you do want your back to be as flat as you can, against the wall. Same thing with your head. All righty. So the next one we're going to go, it's going to be through the wall chest stretch. So it's going to stretch your pec minor. All right. So you're going to find a corner. From there, you're going to go into 90 degrees, and then you're going to dig your chest into the wall and really feel those forward muscles stretch out. This one, usually I recommend my patients to hold it for 30 to 45 seconds and do about 3 to 4 sets. And it really, really, really feels nice. At the beginning, you're like, oh my God, this is a lot. But the more you do it, the better it feels. From there, we're going to do a pec major stretch. So for this one, it's going to look like a cross. Same thing. You want to do in a corner, straighten your arms out and dig your chest into it. Same thing, 30 to 45 seconds, 3 sets. All righty. So the next one we're going to do is going to be the bent over stretch. This is for your lats. I'm going to move on again. So this one, you want to find a high surface. You're going to straighten your arms out, and then you're just going to kind of dig into it, and you should feel the stretch right in this portion. A lot of times that helps out with not ability to reach up because you feel tight in this section. So it's really going to help out stretch out. Same thing, 30 to 45 seconds, 3 to 4 times. So the next one we're going to do thoracic extensions. Right now, we'll go back to the ankle stretch. So for this one, it's going to help for this part of the spine that really gets tight from sitting, in a desk a lot. So you put your elbows on top of the desk, you interlock your hands behind your head, and then from there, you let your chest dig in, and you should feel this part of the spine really extend. So for this one, you do want to do about 15 to 20 repetitions. You don't have to hold it more than 1 or 2 seconds, and then kind of get out of it and then go into it, and it will improve your posture. Okay. Then the last one we're going to do standing is going to be the ankle stretch. So for this one, you want to find, again, a wall. You'll prop your foot against the wall. There we go, midfoot. And then from there, you just lean into it. And that will really stretch that calf muscle. Again, 30 or 45 seconds. So from sitting for a long time, a lot of times I even do this here at work because, they get tight from sitting down all day long. All right. So next one we're going to do, we're going to go through sitting stretches. So we can go to the next slide. All right. All right. So the first one we're going to do is going to be an upper trap stretch. So again, that's for the trapezius, where we tend to get a lot of trigger points. You want to hold the opposite hand to the bottom of the chair, come with the opposite hand and side bend your neck. And you should really feel the stretch right in this portion. All right. The next one is going to be the levator scap stretch, which also targets the posterior muscles from your neck. And that one you hold, same thing, opposite side. You bring your head down, twist it, and then you should feel the stretch more towards the posterior side of your actual neck. Okay. Next one is going to be the hamstring stretch. So we all tend to have very tight hamstrings, again, from sitting down all day long. Let me come a little further so we can have better view. And that one, you just straighten your leg out, you lean into it, and you should feel that stretch right behind your leg. 30 to 45 seconds, 3 to 4 times. All right. And then this one, I like it a lot. Same thing, from sitting down a lot of times, your low back starts to spasm a lot. You tend to get a lot of lower back pain. So this one, it's a forward lean stretch. So you grab a stool, you grab a chair, you just lean forward, and you should feel the stretch all in the back of your muscles from your lower back all the way running up to your middle back. All righty. And then same thing, thoracic extensions. You're seated. Put your hands right behind your neck. And then you just extend your back against the backrest of your chair. And it'll provide more mobility to your middle spine from sitting down. And then the last one, this one, I give it a lot to my patients who complain of like sciatica, that pain, or like the piriformis syndrome from the pain running down your leg. It's a figure 4 stretch. So you put your leg like that, you push down the opposite knee, and then you just lean forward into it. And you should feel stretch in your glutes and your hamstrings and in your piriformis. All righty. And we can go to the next slide. All righty, guys. So that's basically it. Okay, so I didn't want to make it, a lot of words. I just wanted to talk instead of just showing a lot of words on the presentation. I want to use more pictures on live demonstration, because a lot of times you might see it words and you're like, okay, what is this guy talking about? So I just want to get a little bit overview of the importance of ergonomics in our work. Depending if you're doing an office job or we're working in labor, it is important to take care of your body, because your body is the one that's going to kind of keep you going through every day. The analogy I like to use with my patients is that treat your body as it was that brand new, Mercedes or Audi that you just bought. You want to take care of the tires, the suspension, everything. That's our body. If you don't take care of it, you're gonna have to change the tires. Your suspension is gonna go out. That you gotta give it the oil changes and everything. Same thing with our body. If we don't take care of it, whenever we're at work, whenever we're doing our shopping, everything, it's gonna start to have issues.
Awesome. Well, thank you so much, Dr. Arias. This is an extremely informative presentation. I know a lot of our employees are really going to benefit from these exercises that you provided, especially those working in the office setting. So we can now open it up for a Q&A session. We do have a couple of questions here. Somebody's asking if if the video with the exercises will be available on YouTube. So we, as part of these presentations, as soon as they're finished, they are going to be available as a recording link on the virtual website that we have for all of our employees. 30 days after after today, so after the event finishes, they will be available on our YouTube channel as well. So for 30 days after this, they'll still be available on the website. You can log in as you normally do as an attendee, and you can access them in the same location where you opened up this link. And then after that, they'll be available on YouTube as well. So we do have some other questions. I noticed a picture. Do you recommend footrests for anyone who's sitting at a desk? Does that help with posture as well?
So it depends on you. So I know on the picture it does say that you can either have your feet flat completely on the ground or have a footrest. So it depends also, for example, on the mobility. So I know even from my own experience, a lot of people, they tend to have very tight calves. So having a little footrest will put that foot into like a little elevation. So it might feel a little bit uncomfortable if you have very tight calves. So if you feel that it's not helping you, it's actually creating more discomfort, then I would just go feet flat on the ground.
Gotcha. Okay, cool. But maybe something to try out and see if
Yep.
you
Yeah, for
like
sure.
it. Awesome. We have somebody that asked, are yoga balls good for posture? I'm assuming they mean the exercise balls that you maybe sit on, that you kind of see as something people
So,
do. Right?
so I've actually encountered this question before from patients. They're like, hey, if I sit in a yoga ball, will it help me? It can help you, but it can also be a little detrimental, okay? Because what happens with yoga balls is that we use them a lot for core stability for exercises. But when you're sitting for a prolonged time on a yoga ball, you really have to have a very, very, very strong core in order to keep a stable spine, because it is a very uneven surface. So basically, it puts you at more predisposition from getting injured and having low back pain than actually the benefit it can. So if it's something that you can do at home while you're watching TV and kind of do some exercises, yes. But would I recommend it for an 8-hour day sitting on a yoga ball? I wouldn't recommend it.
Okay, that's definitely good to know. I think that's kind of a common misconception then, that to have one in the office area. Okay, awesome. For the stretches that y'all were demonstrating earlier, about how often should we be doing these stretches? And is there a certain point where if we are feeling pain, that pain might go away, or that we might, start? Is there like a routine, I guess, that should be established there?
Yeah, so for when it comes to stretches, honestly, I wouldn't say the more the merrier, but sometimes I do have patients that they're like, hey, I stretched out 10 times during the day. I was like, okay, maybe that's a little bit too much, you know?
Yeah.
But if you're at work, I would maybe recommend once every 2 hours that you kind of, you know, stand up, do a little stretch, do your neck. More so, I would recommend the neck stretches and the lower back stretches just because of the postures that we do tend to get. And I like to use myself a lot with examples of my patients because even myself, even though I know the things that I have to do, I don't do them. You know, sometimes I find myself that I'm documenting for my patients, and when I least notice it, I'm in this position and I
Uh-huh.
start to have that pain. I'm like, okay, you know what, Jonathan, take a break. I step out a little bit, 5 minutes, go into the wall, do my wall angels, kind of stretch out my neck a little bit just to decrease some of that pain. Because again, you wanna do them early so you can prevent actually getting an injury and then having to come and visit me.
Right. Okay, awesome. Thank you. And then just one more question. If these, if these stretches are making, anyone sore, if we're doing them, at least once a day or something, with something kind of like a light stretch like this, if it does, you know, bring about soreness, what would be the best way to relieve that?
So basically, stretches shouldn't create soreness. Actually, stretches
Okay.
they should do the opposite. For example, I
Uh-huh.
do recommend it with athletes or even like the regular people that start coming to therapy. I'm like, hey, it's their first session, second session, and we do some strengthening exercises, and they're like, what if I feel sore tomorrow? And I do tell them, you know what,
Hmm.
get home, stretch it out a little bit, elongate those muscles so you
Hmm.
decrease some of the soreness you'll be having. So
Hmm.
if you're getting sore from doing, then maybe you're doing it too much and you're like
Hmm.
trying to really force yourself. So one of the biggest examples is like hamstrings. Most of us have very tight hamstrings from being in that seated position that tend to get very tight. So whenever you stretch them out, you're trying to really push yourself and then you get some like pain and discomfort, maybe some like what you can call soreness. So I wouldn't go to that extreme, I would like back off a little bit. You should feel a little bit of discomfort because I like to tell patients stretching out doesn't always feel very nice when you're doing it, but then the after effect is when it feels nice, because now your
Hmm.
muscles are relaxed and now you feel, the ability to seat better, to have less pain, to have less discomfort.
Okay, awesome. Well, yeah, that's really good information. Thank you so much.
No problem.
Alrighty, well, I think we'll go ahead and round it off there. Thank you, Dr. Arias, very much for your time coming over today to present on this topic.
I appreciate you guys inviting me. Like I said, we do have the 3 locations. I am in the North 10th Street. A lot of my patients like coming here because I'm right here where Kohl's and Marshalls and Ross are and
Target.
Target. So
Yeah,
patients like coming and then they do like some therapeutic shopping after therapy. So it
yeah.
helps out. It's a combination.
Definitely a nice little break after that. Yeah. Awesome. Well, thank you so much. Thank you everyone for your participation. This does conclude our third webinar of the 2022 Hidalgo County Employee Winter Wellness Fair. Be sure to check out the rest of our online platform or join us in person at the Precinct 2 Indoor Sports Complex. If you have any questions, you can always message us through our chat feature, or you can email us at hidalgocounty.wellness@co.hidalgo.tx.us. And we'll see you at our next webinar. Thank you so much.
Have a good day.
Bye-bye.